Many of us think of it as an ingredient just for baking, or something that keeps our fridge odour-free. But baking soda is incredibly good for your health and your entire home. Baking soda is a popular household product, and it goes by the names sodium bicarbonate, bicarbonate of soda, and sodium hydrogen carbonate. The baking soda formula represents its composition of sodium ions and bicarbonate ions. It's a supplement known for its alkalinizing effect, thanks to a baking soda pH of 9. Some people get confused with baking soda and baking powder. Baking soda is a chemical leavening agent, and so is baking powder, which means that when they're used in baking, both the baking soda and the baking powder causes batter to rise. Throughout history, it's been used as a rising agent when baking. It's 100% sodium bicarbonate, so when it's mixed with acid, it makes bubbles and it gives off carbon dioxide gas. This is what causes the dough to rise. Baking powder and baking soda are similar, yet different, since baking powder is made up of sodium bicarbonate and one or multiple acid salts. Baking soda is known to help neutralize acid and to improve pH balance in the body. It's often used internally to quell digestive dismay, such as acid reflux or heartburn. When these complaints are due to the overconsumption of acidic food or a general acidic state of body, slowly drinking some baking soda in water can help to neutralize the acid and get your body's pH back to normal. Baking soda has been shown to kill off bacteria, including Staphylococcus mutans, which is a type of bacteria that's associated with tooth decay. It's also effective against various fungal groups, including yeast, dermatophytes, and molds, and these can cause skin and nail infections in humans. Research reveals that baking soda use includes the promotion of kidney health. A clinical study that was published in the Journal of the American Society of Nephrology looked at the effects of sodium bicarbonate on 134 patients with chronic kidney disease and low blood bicarbonate levels. The subjects who supplemented with bicarbonate tolerated it well, and they were significantly less likely to experience the rapid progression of their kidney disease. Additionally, there were less patients that developed end-stage renal disease in the bicarbonate group when compared to the control group. Overall, the researchers concluded that the study demonstrated that bicarbonate supplementation slows the rate and the progression of renal failure and end-stage renal disease, and it improves nutrition status among patients with chronic kidney disease. According to the CDC, urinary tract infections are one of the most common infections, and as the Mayo Clinic points out, women have a higher risk of developing them. A scientific study published in 2017 looked at the effects of baking soda on female patients who had lower urinary tract symptoms, who also had acidic urine pH levels lower than 6. After 4 weeks of supplementation, the researchers found that the urine of the subjects was alkalinized, and there was a significant level of positive effects on the symptoms and the symptom score. Overall, baking soda appears to be an easy, inexpensive way to improve urinary tract symptoms accompanied by acidic urine with little to no unwanted side effects. A scientific article published in 2013 titled Practical Considerations for Bicarbonate Loading and Sports Performance points out that studies to date have demonstrated that taking sodium bicarbonate before exercise, which is also known as bicarbonate loading, may have a moderate positive effect on athletic performance, and this includes 1 to 7 minutes of sustained strenuous exercise. In addition, sodium bicarbonate may also be helpful for prolonged physical activity involving intermittent or sustained periods of high-intensity training. According to the author of the article, Dr. Louise Mary Burke, it could be useful to try and support the training session to allow the athlete to train harder, but also to reduce some of the negative effects of having a high acidity in the muscles. so you may get less damage to the muscle and a better training outcome in the long term. Another small clinical study of 8 healthy male subjects found that consuming baking soda before intermittent cycling improved their sprint performance. If you or someone you know has gone through chemotherapy, then you probably already know the bad side effects of this cancer treatment. For example, there's undesirable changes to the mouth and the throat, which can occur in some patients. Rinsing with baking soda mixture daily can help to improve these unwanted side effects. Combine a quarter of a teaspoon of baking soda with an eighth of a teaspoon of sea salt and 1 cup of warm water and rinse your mouth 3 times per day. You can create your own natural deodorant by mixing a teaspoon of baking soda with enough water to create a milky baking soda paste. Then rub this under your arms or even on your feet. You can remove dead skin from your face by creating your own baking soda exfoliant. Combine 1 teaspoon with half a cup of water, then rub it on your face in a circular motion, and then rinse. Using baking soda for face exfoliation is an inexpensive way to refine skin. Just don't use it too frequently because you don't want to upset the pH balance of your skin. To scrub away dirt and odours, mix baking soda with warm water and rub it on your hands. This natural hand cleanser will leave your hands clean and soft. Create your own foot bath with 1 tablespoon of baking soda and warm water. This baking soda bath will remove bacteria and odours, and it can help prevent against toenail fungus. Baking soda can help to reduce discomfort from sunburn, allergic rashes, and skin affected by poison ivy and poison oak. Mix a teaspoon with some water to create a baking soda paste and apply it to areas of concern. Leave it on for several minutes and then rinse. You can do this a few times per day. Splinters will come out naturally after a few days of soaking in baking soda. Use a mixture that includes a tablespoon of baking soda and warm water. Soak the affected area twice a day in the baking soda water. Rub baking soda on a bug bite to relieve the itching. Create a paste with a teaspoon of baking soda and water. Keep applying the soda paste around 3 times per day until the bite dissipates. Fragile, sunburned skin will benefit from soaking in a mixture of baking soda and water. Soak in a warm but not hot bath that includes half a cup of baking soda. Add a teaspoon of baking soda to your shampoo. Rub it into your hair and rinse as usual. Baking soda shampoo is ultra clarifying, so it's a great way to remove dirt and oil, as well as residues that's left over from other hair products. Create a paste by combining 2 teaspoons of baking soda with 1 cup of water. Coat your brush and your comb with the paste and then rinse thoroughly. Baking soda toothpaste is a great way to improve dental health. It's known to increase plaque removal. This is why it's commonly used in both conventional and natural toothpaste. Straight baking soda has abrasive qualities, and over time it may wear away enamel. So instead, to keep fresh breath, you can add it to your toothpaste. Make your own homemade toothpaste, or just dip your toothbrush in baking soda a few times a week. To keep your teeth looking pearly white, create your own paste with a teaspoon of baking soda and water. Once a week, rub the paste onto your teeth. Let it sit for 5 minutes and then rinse your mouth. This is a great natural way to whiten your teeth and to kill bacteria without any harsh, questionable chemicals. Manufacturers of conventional heartburn medicines include sodium bicarbonate in their formulas. It's a cost-effective way to reduce heartburn and indigestion. Simply add half a teaspoon to 2 cups of water, 1 hour after eating, and drink this mixture to gain some relief. When you have a pH imbalance, unhealthy organisms are able to flourish, which damages tissues and organs and compromises the immune system. Baking soda is known to increase the pH of acidic tumours without affecting the pH balance of healthy tissues and the blood. Scientific research has demonstrated that oral doses of sodium bicarbonate can raise tumor pH and inhibit spontaneous metastases in animal models of metastatic breast cancer. Soaking in a bath with half a cup of baking soda is said to help neutralize lactic acid buildup in the muscles after a workout. Some studies also point towards its internal use to reduce fatigue post-workout. It may also enhance the athletic performance when consumed prior to physical activity. As an alkaline substance, baking soda buffers acids in the body, and it helps to keep the pH levels balanced. Low-functioning kidneys have a hard time removing acids from the body, so consuming baking soda can help with just that, and some research has shown it may also slow the progression of chronic kidney disease. Because baking soda neutralizes stomach acid, it can be helpful for ulcers. You should speak to a doctor first before taking it internally to help to relieve an ulcer though. You can make your own natural scrub by adding a teaspoon of baking soda to water. The pasty mixture is a perfect way to remove bacteria from fruit and vegetables. If you experience a minor grease fire in the kitchen, you can also use baking soda to extinguish it. Baking soda's use historically includes the natural treatment of the common cold and the flu. Recommended doses from the Arm & Hammer Company for the colds and influenza date back to 1925. On day 1, the first day consists of 6 doses of half a teaspoon of baking soda in a glass of cold water at about 2-hour intervals. Day 2, on the second day, the company advises that the individual take 4 doses of a half teaspoon in a glass of cold water at the same intervals. And day 3, the third day, includes 2 doses of half a teaspoon in a glass of cold water in the morning and the evening, and thereafter a half teaspoon of baking soda in a glass of cool water each morning until the cold or the flu symptoms are cured. To calm an episode of indigestion, a common dose recommended is to add a quarter of a teaspoon of baking soda to a glass of water. This can help to reduce stomach acid, but it's important to remember that not all indigestion is caused by an overproduction of acid, so if you still have symptoms 2 weeks later, speak to your doctor. It's always best to slowly sip a baking soda and water mixture when taking it internally. Avoid taking a baking soda and water mixture in which the baking soda is not fully dissolved. Avoid taking more than 3.5 teaspoons in a day. Avoid taking more than 1.5 teaspoons a day if you're over 60 years of age. Avoid taking the maximum dose for longer than 2 weeks. Avoid drinking baking soda solution too quickly. And avoid taking it when you're overly full to avoid gastric rupture. Baking soda use for the skin or the body is generally considered safe and non-toxic. Consuming it orally is also safe, but don't exceed the recommended dose. Too much baking soda can upset the body's acid-base balance, leading to nausea, vomiting, and abdominal pain. Rare cases of baking soda overdose can lead to seizures, coma, and even death. It's high in sodium, 1,259 milligrams in 1 teaspoon, so high doses are not safe. High doses can raise blood pressure and cause swelling. In severe cases, it can overload circulation and lead to heart failure. People who consume too much baking soda have reportedly developed blood chemistry imbalances and heart malfunction or ineffective pumping. Another reason to not overdo your consumption is that it can increase potassium excretion, which can lead to a potassium deficiency. If you have edema, liver disease, kidney disease, or high blood pressure, you should avoid taking it internally. You should also refrain from consuming it if you're pregnant or breastfeeding. If you're on prescription drugs, consult your doctor before consuming it, and make sure that you speak to your doctor about drinking baking soda if you're on a sodium-restricted diet. You shouldn't take it within 2 hours of taking other medications, and it's also not recommended to give it to children under 6 years of age unless directed by a doctor. If you're using baking soda to treat a medical condition and it's been more than 2 weeks, it's a good idea to see your doctor to be sure that you can continue self-medicating. Some products that may interact with baking soda include aspirin and other salicylates, barbiturates, calcium supplements, corticosteroids, medications with a special coating to protect the stomach, lithium, quinidine, and diuretics. You should speak to your doctor before using sodium bicarbonate if you're currently taking any medications or have any ongoing health concerns. For such a low-cost supplement, this is one really affordable natural remedy with a seemingly endless list of uses, from cleaning your bathroom or cleaning your face to calming indigestion and even providing a workout boost. All of the many benefits of baking soda make it a pretty amazing substance. As sodium bicarbonate is highly alkalinizing, when used correctly, it's been shown to help kidney, urinary, and digestive health concerns. Even if you're not interested in the internal or the topical use, it's recommended as one of the best things to have around your home for some really effective yet non-toxic cleaning.